Neurocognitive disorders represent one of the greatest medical and social challenges of our time, affecting over 55 million people worldwide and fundamentally altering the lives of countless families, communities, and healthcare systems. These complex brain-based conditions, previously known as dementia or organic brain syndromes, encompass a broad spectrum of disorders characterized by significant cognitive decline from previously higher levels of functioning. Unlike the subtle memory changes that naturally occur with aging, neurocognitive disorders cause substantial interference with independence and daily functioning, progressively robbing individuals of their memories, reasoning abilities, and ultimately their sense of self. The evolution of our understanding of neurocognitive disorders has been remarkable over the past several decades. The term itself was introduced in the Diagnostic and Statistical Manual of Mental Disorders 5th edition to better reflect the neurobiological basis of these conditions and to acknowledge the spectrum of severity they encompass. This modern classification system recognizes two primary categories: mild neurocognitive disorder, where cognitive decline is noticeable but doesn't significantly interfere with independence, and major neurocognitive disorder, where cognitive impairment substantially compromises daily functioning and requires varying degrees of assistance and supervision. The underlying pathophysiology of neurocognitive disorders involves complex interactions between genetic predisposition, environmental factors, and various disease processes that damage brain tissue or disrupt neural networks. Alzheimer's disease remains the most common cause, accounting for approximately 60 to 80% of all cases and characterized by the accumulation of amyloid plaques and tau tangles in brain tissue. Vascular neurocognitive disorder, the second most common type, results from reduced blood flow to the brain due to stroke, small vessel disease, or other vascular pathology. Lewy body disease involves the accumulation of alpha-synuclein protein deposits and often presents with visual hallucinations, movement disorders, and fluctuating cognitive abilities. Frontotemporal disorders primarily affect the frontal and temporal lobes, leading to changes in personality, behavior, and language, while initially sparing memory functions. Other significant causes of neurocognitive disorders include traumatic brain injury, which can result from accidents, sports injuries, or military combat, and may lead to immediate or delayed cognitive impairment. Parkinson's disease dementia develops in individuals with established Parkinson's disease, typically characterized by executive dysfunction, attention problems, and visual spatial difficulties. Huntington's disease, a genetic disorder, causes progressive cognitive decline alongside characteristic movement abnormalities. Additionally, various medical conditions including HIV infection, prion diseases, substance use disorders, and metabolic conditions can lead to neurocognitive impairment, highlighting the diverse etiologies of these complex disorders. The cognitive domains affected by neurocognitive disorders encompass the full range of mental processes essential for daily functioning. Complex attention involves the ability to sustain focus over time, divide attention between multiple tasks, and process information efficiently in the presence of distracting stimuli. When this domain is impaired, individuals may struggle to follow conversations, complete multi-step tasks, or maintain concentration during activities they previously found routine. Executive function, often considered the CEO of cognitive abilities, includes planning, organization, working memory, cognitive flexibility, and abstract reasoning. Deficits in executive function manifest as difficulty making decisions, solving problems, managing finances, or adapting to changes in routine. Learning and memory impairments represent perhaps the most recognized symptoms of neurocognitive disorders, affecting the ability to encode new information, consolidate memories, and retrieve previously learned material. These deficits progress from difficulty remembering recent events to eventual loss of remote memories and learned skills. Language dysfunction may begin with subtle word-finding difficulties and progress to more severe impairments in comprehension, expression, reading, and writing. Perceptual motor skills encompass visual spatial processing, construction abilities, and motor coordination, with impairments affecting activities such as driving, navigating familiar environments, or using tools and appliances. Social cognition involves recognizing emotions, understanding social cues, and maintaining appropriate interpersonal behavior, with deficits leading to social withdrawal, inappropriate behavior, or loss of empathy. The progression of neurocognitive disorders typically follows predictable patterns, though the rate and specific manifestations vary considerably among individuals and underlying causes. In the earliest stages, symptoms may be so subtle that they're attributed to normal aging, stress, or depression. Mild cognitive complaints might include occasional forgetfulness, difficulty concentrating, or challenges with complex tasks like managing finances or following complex instructions. As the condition progresses to mild neurocognitive disorder, cognitive changes become more noticeable to family members and friends, though the individual often maintains independence in most daily activities. The transition to major neurocognitive disorder marks a significant milestone where cognitive impairment substantially interferes with independence and daily functioning. Individuals may experience severe memory loss, confusion about time and place, difficulty recognizing familiar people, poor judgment leading to safety concerns, and inability to perform complex tasks such as cooking, driving, or managing medications. In advanced stages, individuals may lose the ability to communicate effectively, recognize family members, or perform basic self-care activities, requiring comprehensive care and supervision. Behavioral and psychological symptoms often accompany cognitive decline and can be among the most challenging aspects of neurocognitive disorders for both patients and caregivers. These may include agitation, aggression, wandering, sleep disturbances, depression, anxiety, delusions, hallucinations, and personality changes. Understanding that these symptoms result from brain pathology rather than willful behavior is crucial for developing appropriate management strategies and maintaining compassionate care approaches. The diagnostic process for neurocognitive disorders requires comprehensive evaluation by qualified healthcare professionals, typically involving multiple disciplines including neurology, psychiatry, neuropsychology, and geriatric medicine. The assessment begins with detailed medical history taking, including information from family members or close friends who can provide observations about cognitive and functional changes over time. Physical and neurological examinations help identify potential underlying medical conditions or neurological signs consistent with specific disorders. Cognitive assessment tools range from brief screening instruments used in primary care settings to comprehensive neuropsychological evaluations that provide detailed analysis of specific cognitive domains. The Mini-Mental State Examination and Montreal Cognitive Assessment are commonly used screening tools, while more extensive testing may include measures of memory, attention, executive function, language, and visual spatial abilities. These assessments help establish baseline functioning, identify specific patterns of impairment, and monitor progression over time. Laboratory testing plays an important role in ruling out potentially reversible causes of cognitive decline, including vitamin B12 deficiency, thyroid disorders, syphilis, HIV infection, and metabolic abnormalities. Neuroimaging studies such as CT or MRI scans can identify structural brain changes, strokes, tumors, or other abnormalities. Advanced imaging techniques, including PET scans, may detect characteristic patterns of brain metabolism or specific protein deposits associated with different types of neurocognitive disorders. Emerging biomarker research holds promise for earlier and more accurate diagnosis of neurocognitive disorders. Cerebrospinal fluid analysis can detect abnormal levels of proteins associated with Alzheimer's disease, while blood-based biomarkers are being developed to provide less invasive diagnostic tools. These advances may eventually allow for diagnosis before significant symptoms appear, opening opportunities for earlier intervention and prevention strategies. Treatment approaches for neurocognitive disorders focus on multiple goals: slowing cognitive decline when possible, managing behavioral symptoms, optimizing remaining abilities, and improving quality of life for both patients and families. Pharmacological treatments approved by regulatory agencies include cholinesterase inhibitors such as donepezil, rivastigmine, and galantamine, which may provide modest cognitive benefits and help manage behavioral symptoms in some individuals with Alzheimer's disease and other neurocognitive disorders. Memantine, an NMDA receptor antagonist, may be beneficial for moderate to severe stages of Alzheimer's disease. However, it's important to understand that current medications do not cure neurocognitive disorders or dramatically alter their progression. Recent controversies surrounding new Alzheimer's drugs highlight the ongoing challenges in developing effective treatments and the importance of realistic expectations about therapeutic benefits. Non-pharmacological interventions often provide equal or greater benefits and should be considered first-line treatments for many symptoms. Environmental modifications can significantly improve safety and reduce confusion for individuals with neurocognitive disorders. These may include simplifying living spaces, removing potential hazards, installing safety devices, using calendars and reminder systems, and maintaining consistent daily routines. Cognitive stimulation activities, social engagement, and structured programs can help maintain cognitive function and improve quality of life. Physical exercise has shown particular promise in potentially slowing cognitive decline and improving overall health and well-being. The impact of neurocognitive disorders extends far beyond the affected individual, creating profound challenges for families, caregivers, and entire support networks. Family members often experience a complex grief process as they witness the gradual loss of their loved one's personality, memories, and abilities. The concept of ambiguous loss describes the unique pain of losing someone who is physically present but psychologically absent. Spousal caregivers face particular challenges as they lose their life partner while simultaneously taking on increasing caregiving responsibilities. Caregiver burden encompasses physical, emotional, financial, and social challenges that can significantly impact health and well-being. Studies consistently show elevated rates of depression, anxiety, and physical health problems among caregivers of individuals with neurocognitive disorders. The chronic stress of caregiving, combined with sleep disruption, social isolation, and financial pressures, creates a perfect storm for caregiver health problems. Recognizing and addressing caregiver needs is essential for maintaining the care system and preventing caregiver burnout. The economic burden of neurocognitive disorders is staggering, with global costs estimated in the trillions of dollars annually. Direct medical costs include physician visits, medications, hospitalizations, and long-term care services. Indirect costs encompass lost productivity, informal caregiving time, and opportunity costs for family members who reduce work hours or leave employment to provide care. As populations age worldwide, these costs are projected to increase dramatically, highlighting the urgent need for effective prevention and treatment strategies. Support services and resources play crucial roles in helping individuals and families navigate the challenges of neurocognitive disorders. Organizations such as the Alzheimer's Association provide education, support groups, helplines, and advocacy services. Adult day programs offer structured activities and socialization opportunities while providing respite for caregivers. Home health services can assist with personal care, medication management, and household tasks. As care needs increase, specialized memory care units in assisted living facilities or nursing homes may become necessary to ensure safety and appropriate care. Legal and financial planning becomes increasingly important when neurocognitive disorders are diagnosed. While individuals retain decision-making capacity, it's crucial to complete advance directives, designate healthcare proxies and powers of attorney, and make important decisions about future care preferences. These conversations, though difficult, ensure that the individual's wishes are known and can be honored as the condition progresses.